Welcome to our YouTube channel of Trishula Foundation. Our main objective is to provide all the information related to cerebral palsy based on scientific facts. If you like the information from the video available on our YouTube channel and want to keep an eye on all the latest updates, then please subscribe our YouTube channel of Trishula Foundation. Again, we are here. The greeting from Trishula Foundation. Welcome to our YouTube channel of Trishula Foundation. Now we are going to have a lecture on second part of the neck control, how we can improve the neck control in children with cerebral palsy. This many methods has to be tried, and that should be started first. As you know that good head control is very important for all the developmental milestone which is going to be achieved by the child in future, and that should be the initial, that should be the fundamental basis for attaining any developmental milestone. In normal children, most of the time neck control is matured at the age of 6 months, but in cerebral palsy it is delayed and subtle, it never happened. So that we have to try our best with every modalities to improve the neck and tongue control before doing any other exercises, including the general exercises and extremity exercises. So in this talk we will talk about how to improve neck control. Neck control can be achieved just by the strength training exercises for the core and spine muscle, especially focusing on the trunk and neck muscles. Sensory stimulation is very important. In the sensory stimulation, we have to take utilization of the vision stimulation, vestibular, that is the balance, postural control, auditory stimulation, so that child can know what activity the parents or therapists like to be done by the child. Postural control, we have to work hard on the postural control, how to child sit and in which position child will have the good postural control. Just like in Padmasana and Palki position and sitting on the stool, long sitting, that can have a good control on the spine. Relaxation, powder massage is very important in dyskinetic cerebral palsy. If child muscle is very weak in spine muscle, then we have to do lots of stimulation in the paravertebral muscles just by the thumb pressure and other ways. Lots of other activities are here to improve the neck control. In some cases where we not able to get the good neck control, then we have to advise spinal and neck braces to support the neck, just like in the cases where no neck control at all in elder children. Exercise can be done by many methods, but our focus should be there to strengthen all the paravertebral deep flexor muscle of the neck and core and trunk muscle. By improving the core and trunk muscle, neck muscle will also be strengthened because all the spinal muscle are joined together in the back. There will be good improvements. The one example has given on this screen. Sensory stimulation, as I have told you, that we have to utilize various different sensory stimulation like the visual stimulations, vestibular means positional sense, proprioception, this joint muscle in movement reception, and auditory system. All this stimulation will go to the brain, then brain will give fine and good signal to the neck muscle so that the head control will be better and better day by day. The parents, where the children are there, the sensory stimulation rooms helps a lot in stimulating these children. We have to utilize very sensory methods like the different color of the light, sound, music, and upright hanging the light strips. Postural control, you can see on this screen that proper alignment of the spine in all sitting position help child in maintaining position of the neck. That can be best by sitting on the low height stools, as well as they allow this child to sit in the cross leg position and Padmasana positions. The Padmasana position helps in the two things, relaxation of the muscle as well as they control in the posture, and there will be good control on neck and trunk muscles. Powder massage. Powder massage should be done on the back in the supine, prone position, sitting position. That relaxes the muscle by firmly pressing on the side of the spinous process on the back. That will stimulate the paravertebral muscle. By the stimulation of that muscle, the neck control can be much easier. In second position, what you can see on the screen, that on the sitting position, where talking with the child with good eye-to-eye contact, and both fingers are your inside of the spine, that will stimulate the that is the neck muscle, as the whole trunk muscle will be there. That have a good impact on the trunk and neck muscles. Activities, lots of activities there, just like a tummy time. The tummy time activity, tummy on tummy, that means on the mother, father on the tummy. Prone activity on the bolster, waist pillows, lateral handling, hand to side lying position on the waist, pull to sit, activities of sensory gym ball, holding upright, reverse pull to sit, reverse cradling, visual tracking in slide. We will discuss one by one. Tummy time activity from the very early age, even that can be start at the age of 1 month. That is a very fantastic activity. That lots of activities has been told previously also, even on the internet, lots of activities available that improve neck control even in normal children. Tummy and tummy activities are also very important. We have to make good eye contact and can have the sing song and talk to the child, so that they will be able to hold the neck by the different sensory stimulation. Eye to eye contact by different methods, just by taking the child on the leg or hanging in the air, that also can also have the good control on the neck. Prone activity on the waist, bolster, but all this activity can have a good impact if you are giving the good positive feedback. That is a very important if you are putting the child in front of the mirror. If child is able to understand that all the activity has to be done in front of the mirror, by seeing all this activity, child will be happy and happy to do lots of activity afterwards. If child is not able to extend the elbow and not able to hold the elbow position, the lots of activity can also be done on stroller and skateboard. It has been seen by the literature that by doing the activities on stroller and skateboard, the neck control can be good improve in time. Reverse cradling, just taking the child prone on the arm, can also have the good function control here. Other activity, just taking the child, just you can see on the screen, taking the child on the shoulder and taking the child like this position and hanging, this head is hanging, and he can see in environment, visual tracking. By the visual tracking, he will have the good control on the neck. Lateral position of the waist, and by reaching the object, as you can see on the screen, that very good improvement in the neck control has been seen. Pull to sit, if the neck control is fair to good. If neck control is not fair to good, then one has to be supported, head has to be supported by the hands, and child should be pulled by the shoulders. Activity on gym ball, but lots of the time I have seen the parents are doing jumping movements. No, this lower part of the body has to be controlled on the gym ball. Then in front, someone has to show some funny ball, some toy, so that child should interact with that activities, so he will be able to hold the neck for seeing and for reaching that objects. Eye to eye contact is very prerequisite for good outcome in every cases of children with cerebral palsy. Repeated auditory, tactile, visual stimulation is must for all the activities, and all the activities should be done in playful environment. We cannot push the child for doing the activity. Child has to be involved in all the activity, then outcome will be good. Sensory positive feedback will be very important. Just I have told you that If you are doing all this activity in front of mirror, the child can have a good improvements. First 2 years are golden period for the child with cerebral palsy. So these 2 years should not be wasted in the general exercises. All the parents are requested, all the therapists are requested to do the lots of activity to improve their neck and trunk control. Hippotherapy is very good for the trunk control. As you know, the trunk control is going to improve the neck control. So that means in long term, hippotherapy have the good impact on both these things. If child is don't have the good neck control, we can utilize the position of the CP chair, and the CP chair they can do lots of activity by the hand, and even for doing the activity he has to maintain head upright so that he can work. Prone standard is also very good in elder children where neck control is only fair to good, not so strong. This one head support collar is given here, that is known as Hinsinger head support, that is rarely has been used for the neck control, but we can use it in some cases where it is rarely required for temporary purpose. If child has some spinal deformity like scoliosis, very poor trunk control, age is too much, more than 4 or 5 years, neck control is 0, it is a child is 5, then you can utilize this spinal brace. This spinal brace which you can see on the screen, that is very good for trunk and neck control. But all these neck braces is very useful, uses 5 levels. Dynamic headport system. On the internet it is available for better visual tracking. This dynamic headport system in this child can do side to side movement, but front to back movement will be restricted. So visual tracking will be poor. With the time, child will have a good control on the neck, so that he can do lots of activity, hand activity also improve. Now we like to know what will be the impact of trunk control on neck holding. As I have told you earlier also, in GMC 5, where child is totally wheelchair bound, neck control is not there. If neck control is not there, GMC 5, trunk control will also be poor. So that they require spinal brace support. And that means GMC 5 level need more trunk control support for visual tracking and better neck control. On the other hand, in GMC 4, where child can be transported with the help of someone, neck control is fair, then in that cases, the support system for the trunk and neck have not had good impact on the child, so that minimum utilization of braces should be done. The some degree of trunk control deficit are always with absent neck holding. So in last, we like to know what precaution has to be taken from the parent, from the therapist during the management of cerebral palsy children where neck holding is poor. No collar in early age groups. No range of movement exercises should be done in this type of the children. Any type of exercises with unnecessary high speed activities should be avoided, because sometimes children have the cervico-occipital junction instability that can harm to the child. Even sometimes paralysis can increase, and this unnecessary high speed movement can increase the dyskinetic movements. So that whenever we have to do activity, the 3 part of the body or 2 part of the body has to be controlled. If you are doing activities on upper trunk and upper extremity, then lower part of the body has to be controlled by someone else. Do not use pediatric ball therapy for hydrocephalus, because head is large, neck control is not there, that can cause cervical cord injuries. Avoid using antispastic medicine if a child don't have good neck control, because neck control absent is there, that means tone is less, muscle is weak. If you are giving antispastic measure, muscle will be more weaker. He will not able to improve their neck control. By controlling the unwanted movement in the body and giving training in activities according to their developmental milestone, give the chance to the child for all round developments. the message is that we don't have to do lots of unwanted movement. We have to make control on all the unwanted movement by relaxation exercises, proper positioning, postural control, powder massage, and train the child in different developmental milestone activities, just like a trunk control, neck control, creeping, crawling, sitting. That will give this good improvement in the child. It will take time depending upon the disability, but ultimately your child is going to improve. Don't encourage standing, walking in your child till you have their full fair neck control. If neck control is not there, they cannot crawl, they cannot knee walk, they cannot stand. Neck control is not there. We can make them stand, but don't allow them walk till they have neck control. What are the long-term impact of poor hand control in elder children? If child become elder, become adult, what will be poor impact? Poor impact mostly occur in the children where they have dystonic cerebral palsy. In spastic, in hypotonic, can have the side effect, but not so much. But in dystonic cerebral palsy, child can have cervical myelopathy, neck pain can be there, and other children, poor use of upper extremity, hand activity will be poor, and child will have poor visual tracking. They cannot see in environment whenever you wanted to see. So, final word is there. It is very important to have neck holding before age of 1 year for future developmental ambulatory capability. Sensory feedback, stimulation, proper posture is the key in the management of immature neck control. Kangaroo care, a dummy. Kangaroo care means taking the child like that with hip abduction and child body is touching your body. Kangaroo care is there. Tummy time means prone developmental activity in the ground. That activity in infancy is excellent way to improve neck holding in early infancy. I have given many references here. Anyone wanted to go and see lots of new thing on the literature, they can go for the bibliography. Lots of literature is there. They can see there and they can get info about the neck control. So, in whole both part of the neck control, we have seen why it is happened, what are the causes, how we can improve, but whatever activity has to be done, that should be done under the guidance of experienced therapist who knows about cerebral palsy, who has got long-term experience in the cerebral palsy management, whereas don't have to try their self just by going to the therapeutic availability on the net. Every child need to be assessed in detail. We have to see what are the problem the cerebral palsy children is there. Every child have a specific problem. So without examination, without evaluation, we cannot say that which type of the cerebral palsy children, which type of the exercise is needed, and every children is totally different. So every parents are requested to take the consultation of a specific therapist who are really trained in the cerebral palsy management. Then they have to work hard, but getting the good neck control and trunk control. Thank you.
सेरेब्रल पाल्सी में अधिक जानकारी के लिए हमारे YouTube चैनल त्रिशला फाउंडेशन और JJN 999 को सब्सक्राइब करें।